Hey guys, my name is Shelby Miller, and I am going to be teaching you about VisualDx. So this is a new tool that I've recently learned about, and it has really impressed me. I am just going to go ahead and read this little portion here. It says, VisualDx is the most used diagnostic decision support system for a reason. When we make a differential diagnosis, seeing the possibilities is more useful than reading about them. We bring fast, informed decision-making support right to the point of care. VisualDx is created by doctors for doctors and healthcare professionals. They're trying to change medicine through improved diagnostic accuracy and quality patient care. I was extremely impressed to learn that half of the world's top medical schools use VisualDx, and over 1,500 hospitals and institutions actually rely on the decision support that VisualDx provides. So the main goal of VisualDx is to reduce error in diagnosis. I really like what it says right here. It says most people will experience at least one diagnostic error in their lifetime, sometimes with devastating consequences. VisualDx is working to change that. This tool is extremely valuable. Alright, I'd like to take you through the website here. First off, it starts with this Professionals tab. It's nice that you can hone in on your general area of practice. So there's emergency medicine, internal medicine, family medicine, pediatrics, dermatology, dentistry, oral medicine, student/resident, medical librarian, and the CMIO, which is Chief Medical Informatics Officers. I'm going to click on family medicine just so we can show you one of the different tabs. And I like what this says. It says in primary care, dealing with specialty level issues is not uncommon. VisualDx is a diagnostic clinical decision support and reference tool of over 1,300 pediatric and adult conditions, represented by nearly 30,000 images, designed to aid physicians in the accurate diagnosis and management of disease. Just specifically in the family medicine department, this helps access specialty level expertise, recognize disease variants, identify drug adverse events, and enhance patient education. Now I am just going to click on the Institutions tab. You can see that it is broken down into hospitals and health systems, accountable care organizations, clinics and group practices, urgent care, medical schools, and public health and government. I am just going to click on urgent care so we can take a look further. So the benefits of using VisualDx in an urgent care setting alone allows you to see more patients per day by saving time during each patient visit. It allows you to print or email patient-friendly handouts with images from VisualDx, which aids in patient education, recognize and rule out life-threatening emergencies, diagnose medication adverse events, mitigate risk for patient injury, and more. Alright, next I'm going to click on the Features tab. This has a general overview of VisualDx. So it has this overview tab, video overview, how it works, web-based, mobile access, visual diagnosis, and VisualDx mobile quiz. I'm going to click on how it works so we can get a general idea. VisualDx is problem-oriented for problem solving. Search by symptoms, visual clues, and other patient factors by diagnosis or by medication. So you can select a clinical scenario and enter patient symptoms to quickly build a contextualized patient-relevant differential diagnosis. Or you can search directly by diagnosis to access disease images and pithy clinical information. Or you can search by medication to view adverse conditions that may be caused by a specific drug. Next, we're going to hit on the Benefits tab here. It also has an overview. It shows the return on investment, the reduce in diagnostic error, engage and educate patients, current therapy and management, in the workflow, recognize drug reactions, and fulfills meaningful use. I'm going to click on in the workflow as it's most pertinent to us. So VisualDx is available where and when you need it, which is very convenient. You can use it on your cell phone. It is also directly linked to UpToDate, and you can also use eRecord. Okay, next I just wanted to hit the Solutions tab here and go to the Overview tab. VisualDx is nice because it integrates health information technologies to help us streamline our workflow. VisualDx can be integrated directly with UpToDate, as I mentioned previously, and also supports the HL7 info button standard for interoperability with the electronic health record. It also allows for continuing learning and risk management, as well as expanding access to care. There's a few more tabs here. You can click on success stories to take a look at those. Here's a tab on the company and some information on why they developed VisualX and where they're at now. There's some VisualDx videos, some promo videos, and educational videos to help you better utilize VisualDx. And the public health tab here is nice. It has information on all of these conditions and diseases. Alright, next I'm going to go ahead and click on this support tab here. This has a lot of information on how to use VisualDx. I'm going to go ahead and click on the video tutorials tab. This has a little short video on what VisualDx is. I'm going to click on the basic search. And we're going to watch a short video on how to perform a basic search in VisualDx.
One of the easiest ways to use VisualDx is through the search bar on the home page. From this area, you can search by diagnosis, medication, or any pertinent findings, such as symptoms or travel. Once you start typing, you choose the most relevant full-length terms. After you choose a term, you'll arrive at an internal page of VisualDx where you can change the clinical scenario, for instance, by changing the age of the patient. You can also start a new search from inside VisualDx using the search bar at the top of the page. If you've entered a symptom like scaly papule, you can easily refine your search from the left column, for instance, limiting the body location to the hand.
So that just shows you how to search. I'm going to click on this tab here showing us how to actually build a differential diagnosis, and we'll watch the first part of this video.
One of the most powerful features of VisualDx is the ability to use individual points of data to build the most accurate problem-oriented differential diagnosis possible. In addition to the professional medical images in VisualDx, we organize medical knowledge with a visual differential diagnosis approach that is really second to none. To start, choose the Differential Builder button from the home screen. VisualDx is not an algorithm or decision-making tree, so you can enter anything you want at any time, and VisualDx will combine the findings to create a differential. Here's an example. Choose a neonate with a rash. Add vesicles. Add the widespread pattern. From the Key Findings menu, add present at birth. And now add fever. And see the differential diagnosis.
Pretty easy to use, right? This video shows how VisualDx helps with patient education. When you're searching and you see a photo, you can click on it, and then in the upper right hand corner there's a little button that says Handout, and if you click on that, it launches a view of trusted and easy to read and understand language, which you can actually email to your patient or print it off for them right there. Alright, next I'm just going to touch on the main benefits of VisualDx. I thought it was interesting to learn that 10 to 20% of all diagnoses are inaccurate and may result in patient dissatisfaction, harm, or serious injury, including death. I'm going to click on the Reducing Diagnostic Error tab. This shows that diagnostic delay and error can lead to patient harm. In fact, mortality data from autopsies showed that 35% to 40% of deaths were due to misdiagnosis. I thought this was an interesting photo here showing that there is, in fact, a medical crisis due to misdiagnosis. And That is the main pro of using VisualDx, is that it's working towards decreasing the amount of diagnostic errors. A few other benefits of using VisualDx is that it actually allows you to see more patients throughout the day by saving time during each patient visit. All of the information on VisualDx is clinically evidence-based. It's completely easy to use and implement, and the system automatically evolves and updates along with medical statistics. There are a few cons to utilizing VisualDx. Number one, it does cost. Every single month you do need to pay a small fee to use it. Number two, VisualDx may not give you complete accurate results with only partial data input, so you need to make sure that all of your searches are completely comprehensive. Number three, I believe that you still need to rely heavily upon your own medical knowledge and what you have personally learned, because no app or computerized tool can take the place of the human brain and intuition. Overall, I've been really impressed with what I've learned about VisualDx, and once I am finally a provider, I'm definitely planning on using it, and I hope that you are too. Thank you for watching my video on VisualDx, the most powerful diagnostic tool in healthcare.